Over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health live stream. Glad you're here again with me. Got a great program for you. We're going to kind of continue a process of talking about why your body hurts. Want to remind you that, if you want to know when we're going to do what we're going to do and how we're going to do it, make sure that you follow me on all your social media sites, whether it's Facebook or Instagram or, you name them. We're on Rumble. We're on iHeart. We're every place. So make sure you follow us and tell your friends to follow us, because the more information that we get out to as many people as we can, the healthier world that we're going to have, in my opinion. And we're going to try to give you the truth of the matter, if you will, instead of the skewed agendas that so many people have. That's why we're here. That's why we do the program, and want to make sure that you have that opportunity to get as much information as you possibly can. This coming Wednesday evening, June the 12th, here in Fairfax, Virginia, at the Roselle Center for Healing, we're going to have a night that we're going to be doing a distinguishing presentation between fibromyalgia and chronic pain patterns. They're very different, but we want you to know what causes them, but more importantly, what can fix them, because it's not about the drugs. And we'll talk a little bit about that today as we go through the program. That's what we want to touch upon, and how you get out of this nastiness, this crazy wind-up experience, if you will. It's important that you understand. It's important that you get it. So with that, let's get into the program just a little bit. And I want to give you some data that you may not have thought about. Let's talk a little bit about the medications that are being used for these chronic pain patterns. First of all, I want you to distinguish a couple things. When you have pain, it can be very severe, regardless of what the cause and the trigger is. Regardless of what the diagnosis is. It could be fibromyalgia. It could be a chronic pain pattern. It could be a phantom pain. It could be all kinds of stuff. But we're not going to use the program today to distinguish the characteristics. I want to talk a little bit about how it's approached in virtually every situation. In the medical community, they're using drugs that don't make much sense to me. Things like gabapentin, things like tramadol, amitriptyline, naltrexone, Lyrica, Cymbalta. All of these drugs dumb down the body's ability to, if you will, receive the pain pattern. And they think by doing that, they can break the cycle, and then the cycle begins to heal the process. That's not how things heal. It stops you from feeling it, and it gives you other side effects, and tons of them, if you will. But here's the deal. When you're dealing with these medications, the side effects are horrible. They're over the top. And we want you to understand that you're risking many different things by using these medications. But more importantly today, I want to tell you about some of the things that are possible that resolve the condition without getting you addicted to the gabapentin, without getting you addicted to Cymbalta, without getting you addicted to Lyrica. Because if you take them on a regular basis, you're stuck. You're locked in. These things are not going to cure anything, but they're going to cause other problems as well. So when we deal with, just over-the-counter things like, acetaminophen and NSAIDs, and that we talked about, a little bit of the antidepressants, the SSRIs, the tricyclates, the SNRIs, they're all addictive psychogenic drugs. And then we just talked about, the gabapentin and the pregabalin and so forth. They don't work, is number one. If you look at the ratings on these things, and ratings have to do with side effects, ratings have to do with do they work or not, and so forth. It's not very encouraging. And I'll let you do that on your own. It's really easy to find. And, a lot of these drugs, they tell you don't drive machinery if you're taking them. Why? Because they knock you out. It's not one of these things that you can take and just kind of do your thing. You can't. It dumbs you down. Let's talk a little bit about what wind-up pain is, because this is an important thing. Wind-up pain is something that triggers pain and continues to perpetuate it over and over again. It can be due to a series of events in the communication pieces of the nerves as they go one to the other, to the other, to the other, to the other. So it's called a synapse, okay? One to the other, synaptic. So when you talk about that, they have something that they trigger. So there's something called NMD receptors, and they're activated. These are receptors that kick in and cause things to be much worse. And we won't get into the chemistry today, but there's something called substance P, and attaches to these what they call NK1 receptors. And you can sit there on your computer and look at this stuff, and they're incorporated into the cells of the body. The neurological cells is what we're talking about. The activation process leads to a removal of magnesium in the body. Magnesium is the number one most deficient mineral across the board. Most of our patients, when we send them out for laboratory work, the laboratory monitors, it's from 0 to 5, if you will, and most of the labs stop at about 2.4. We'd like to see our patients, the high end of normal, at least at 2.4, 2.3, 2.4, so you have enough magnesium. You know what the side effect of magnesium is? You might have a loose bowel. And if you take way, way too much, you might feel really sleepy, really tired. But there really isn't a problem. The removal of magnesium blocks this receptor that we just talked about. And so what happens is that this pain pattern now begins to spiral, and it gets worse and worse and worse. Now, something as simple as that, something as simple as not enough magnesium can cause this wind-up pain in the body where most physicians don't even know that it's involved. And it's right there. I mean, you can go into, the different sites, go into chat box and, Copilot on some of your websites. But when we deal with wind-up pain, it's a central pain pattern. It's a central sensitization pattern, sensitizing the body, right? And it leads the body to not being responsive, to be able to be corrected. It says it's intractable. So wind-up pain is basically the coming together of two distinct things that change in the nervous system. First is how the pain is transmitted through the nervous system, through the fibers of the nerves, and then how the body is supposed to reset that. Now, what we have to understand is wind-up pain is one of the hallmarks of what they call persistent pain. Well, that doesn't make any sense. I mean, pain's pain, and it's there, and it's ongoing. Yeah, it's persistent. And they're saying that they distinguish it between something that's acute, happens right now, and something that's there for a long period of time. So by definition, if you've had pain for any length of period of time, more than a few days, now you're going to get pain that continues the process and potentially winds itself up. So again, there's another interesting piece, is wind-up pain only occurs in artificial created threshold. Now, that doesn't make any sense to me when I go through and I read that. And I want to share the craziness that's out there. It stimulates certain fibers, and there's these whole receptor patterns that show up. You're going to hear things like nociceptors, and all nociceptor means is pain receptor. That's all it means. That's what a nociceptor is, of some sort. Pain can be a sharp pain. It can be a dull pain. It can be a stiffness. Stiffness is included in pain. I don't know about you, but stiffness doesn't really measure as pain. It's not the thing that you want to have around you. You want to be flexible. You want to be able to function. But here's the deal. Let's go back and let's talk about that NMDA receptor that I started the program with, right? So it stands for N-methyl aspartate receptor. Now, when we're dealing with this NMD receptor, there's proteins that are involved in this thing. So one of the things that we've noticed is that people who have low protein diets, and I'm not talking about just from cows or any place else, protein from any sources, but proteins that are too low, they can cause a problem in somebody experiencing pain, chronic pain patterns that just never go away. And when we look at these receptors, it's broken down into subunits that make them up, right? So we're talking about amino acid sequences. Amino acids are what your muscles are made of. You need amino acids to build muscle. You need amino acids to build tissue. And those amino acids then have to be converted into something called peptides. Peptides are actually what stimulates the healing cycle and process within your body. So if you don't have enough amino acids and they can't be converted into the right peptide, then your body can't heal. But more importantly, there's a lot of finger pointing that says, now this is part of what happens, and you have this problem with this wind-up condition. There's something called a glutamate receptor that's involved with this NMDA receptor. Some people say they're one and the same. There's some distinguishing characteristics. If you run an amino acid assay or a neurotransmitter assay, one of the neurotransmitters is glutamate. And you're going to find that it has a lot to do with pain, excitability, and so forth. So it's important to understand that and to be able to fix it. And this Wednesday evening, by the way, I'm going to get into this pretty specifically and show you where this stuff is effective and what it does. There was an interesting article, if you will, that came out of the National Library of Medicine and PubMed, actually. And it got my attention. It talked about this NMDA type glutamate receptor, and that's how they put it together. And they talked about it was excitatory in neurological transmission. So here, follow the chain now. We're talking about wind-up pain, right? So if this NMD glutamate receptors are hyperactive, then it's going to be a major constituent component, if you will, of excitatory neurotransmission in the central nervous system, which is your brain, your spinal cord, and then the peripheral nerves that go out from there. That's not your central system. But here's the brain and the spinal cord not doing what it's supposed to be doing because of these receptors. Now, the question is, okay, Doc, you're talking about a lot of words we don't understand here. So what can we do about it? Well, the first thing you have to understand is that there are these words, right? So there's things like glutamate receptors, and then there's neurotransmitters. We just talked about these are all the things that allow your body. And by the way, do you know where the greatest amount of neurotransmitters, and I'm going to get into that, come from? It's your intestinal tract and your microbiome of your body produces far more than your brain does. And then you have these ion channels. This means that an ion is an uncoupled atom, if you will. So if like H2O is a bound molecule. It has two hydrogen atoms, it has one oxygen atom, and it has an ion that is not bound on either. If it was just oxygen, if it was just hydrogen, it would be an ion. But when they come together, it becomes a molecule. So we have these ion channels that begin to cause irritation. And we have to understand that unless they come together in the bonding pattern that they should, we could have a problem. Now, the reason I'm telling you about these NMDA receptors is that it's really important to understand them in any kind of chronic pain pattern. And it rules the cells within the brain. And if we don't have enough linkage, if you will, bonding, and we have these free ions going on, then we have pain that just doesn't go away. Now, it's a difficult pathway to really appreciate, but it's very straightforward in finger pointing, because then we get into things like a molecule called an ion called glycine. We talk about sodium in this mechanism as well. And they all work together, if you will, to create an equilibrium that is supposed to keep you out of pain. But when you have imbalances, glutamate being one of them, which we just talked about, calcium, if you will, as well, potassium is another one, glycine is another one, sodium is another one, then pain often is excitatory and we can't get it to slow down. So what we want to do is we want to balance these things out. That's the first thing that we have to look at. And to do that, you have to look at different body systems. You have to look at your fight-flight system. What's that? That's your adrenal glands. That's that small little ductless gland that sits on top of your kidneys and puts out all kinds of stuff. The outer shell is going to put out your steroids. It's going to put out your anti-inflammatories, if you will. The inside of the gland produces things like catecholamines and norepinephrine and epinephrine. Now, think about the word, adrenaline. That's where it comes from. That's what those things are made up of. So if your adrenaline system is hyperreactive, then lots of other things aren't going to work the way they're supposed to. And they're going to deplete the system. They're going to cause an excitatory inflammatory reaction in the body that shouldn't be there. So maybe the fight-flight system in chronic pain patterns has to be looked at. Well, from our experience, it does, and you need to fix that. So we've already given you a couple clues, right? You can use certain types of magnesium. You have to upregulate your protein and get enough amino acids within the system to be able to heal anything, to produce those peptides that your body needs to heal stuff with, because without it, you still have that irritation. And in case of fibromyalgia, for example, the fibrous connective tissue is being frayed and it's being irritated and it's swollen. And that's what happens when you look at it in a microscope. But how many of your doctors diagnosed you as a fibromyalgic patient and they did not do a little bit of a muscle biopsy? Or they didn't measure your cortisol, urinary cortisol, or they didn't measure your serotonin. All of these things will lead to a diagnosis instead of ruling something else out and saying, well, this must be what it is. But we have to make sure that we look at the ion balance in the body. We have to look at that magnesium level. We have to look at the amount of sodium that balances the system out, because that's the spark often that goes from one neurological synapse to the other. But, at the end of the day, what you going to do about it? Well, what you're going to do about it is try to find out what's causing the wind up, the upregulation to begin with. Where's the depletion coming from? Where is the body breaking down that's causing the central sensitization, if you will, this wind up problem, this phenomena, this intractable pain that doesn't go away? How can we fix it without having to dumb it down with all these drugs that we take? It doesn't make sense to me that we don't look at basics. And this is what I want you to do, is I want you to look at the basic way that the body so intimately and beautifully works together to express itself in a normalized fashion. It's because of the things that we do to it, the dietary indiscretions that we have. In today's world, and we often talk about it, that it's not the same world relative to fuel and exposures that was there when I grew up. A tomato does not tastes like a tomato today. A piece of bread is not a piece of bread. It's loaded with chemistries, regardless of where you get it. Even when you try to do the best you can and you get, not GMO, but GMO free, it would be great. But they say it's organic and you do your best to get that, but it may be altered in some way as well. When we're exposed to all the electromagnetic fields around us, your body is getting zinged and it needs things to repair it. And if we don't have that repair process, we end up having things like wind-up pain. So magnesium and potassium and sodium and calcium have to be in balance so the system works properly. If it's not, your muscles start hurting. And that wind-up pattern goes to the central nervous system, to the brain. And it kicks back down. And it winds back up. And it kicks back down. And you're in pain all the time. So you can block the threshold. You don't need the drugs to do it. You don't need the gabapentin. You don't need the Lyrica. You don't need the Cymbalta. That's just masking the problem. What they're thinking of doing by doing that is if they can stop this wind-up effect, that maybe the system will quiet down. But I haven't heard of one person that's been put on medication that gets off of it completely. But with the things that we know about and have treated patients for 47 years with, finding what the sensitivities are in the body, finding what may be causing a neurological irritation, in my world of chiropractic, we're talking about often misalignment of the structural system that continues to irritate the central cord and subsequently causing problems upregulating to the brain. So if that's the case, if we can find that distortion and fix it, that should be able to minimize it. If we have an imbalance in the energetic system, and if we use low energy light laser and acupuncture, along with neurological input, and we can normalize that system while at the same time adding some of the bases of supplementation. Now, if we use supplementation, magnesium, potassium, and things like that, as a medication, now we're just practicing allopathic medicine in a natural way. How about fixing it? How about you cleaning up your dietary patterns? How about you calming the nervous system down, meditation or prayer, if you will, so the body doesn't continue to eat itself? We have to make sure that we support our body in the most natural way as possible. I've gotten involved in a lot of different pathways over the years. I've been involved in meditation. I've been involved in looking at the body's natural exposures to the environment and so forth. So we're looking at the mind, we're looking at the chemistry and the physiology, how it works. I played ball in college. I was involved in martial arts throughout my years as well. And when the body is working in this beautiful, harmonious synchronicity that it was designed to work in, we don't have a problem. It's when we mess it up. It's when we go from something that we should be able to modify in a gentle way, and then we overdo it with something that's going to dumb it down so we don't have to experience the symptom. That's where we get in trouble. And we're going to continue to try to give you the tools, the pieces, the information, how to fix the puzzle, your human expression. I promise you that if you continue to take little pieces of what we talk about and you make minor changes, you start, walking every morning, you start stretching every day, you start praying or meditating every day, maybe twice a day, and you calm yourself down instead of listening to the talking heads, that you listen to some gentle music that supports you, that makes you feel good. That you see a child and you look in those beautiful eyes and you smile. All of those things bring an energetic to you that allow your body to go into an equilibrium. We may need things in a short period of time to be able to make a difference. You may need B complex and magnesium and potassium and so forth. It's individualistic, by the way. You may need to detox to get the garbage out of your system, so you at least dumb down, the constant poking, if you will, to that nervous system. And we can show you how to do that. And we will show you how to do that specifically on other programs to come. But I want to give you the tools. Why don't you start today and do this? If you have a pain pattern, something that is not supporting you, meaning your life because you can't function, because you're hurt all the time, why not try this? Why not go get some magnesium glycinate? And why don't you take, let's say a couple 100 milligrams, maybe 3 times a day? Why don't you go get a very low level organic form of vitamin B? And you want an ionizable form, by the way, if you go ask for one, and take a low dosage a couple times a day. Why don't you add a little Celtic salt to your diet? Maybe about 1/3 to half a teaspoon a day. You say, oh my God, salt? My blood pressure? No, it's not going to go up because it has more mineralization and balance than you can possibly think of. And it's actually good for you, and you need to have that. Give it a try, see what happens. And just doing that and getting out every morning and going for a walk, see how you feel with that. If you're outside the Washington metropolitan area and you want a referral to somebody that does my work, send me a note. We'll refer you to people that we trust. Just go to drtomroselle.com. And by the way, check the site out. There's a lot of things there for you. If you want to get rid of all the toxins, we have hydrogen water filters that you can buy for your house. So there we made a deal with a couple of the companies. And so you can buy them a little less expensive there. Check it out. If you know that you're in trouble, let us know so we can refer you and make a difference. I enjoy doing this program on an ongoing basis simply because of the fact that it gives you the information that you need. My job is to provoke you. My job is to give you tools and make you think and give you opportunity to change anything that's going on with your life. See, I have a simple belief system. As long as you're breathing, your body can heal. As long as you're breathing, you can resolve virtually anything that goes on, with any condition that you have. There's a lot that you can do, but it depends on you. There's a lot that is possible in resolution of all kinds of things, but it has to begin with a decision that you make. To be stuck with pain is not the way life is supposed to be led. To be stuck with not knowing what to do when there are answers is not what you're supposed to be exposed to. So if I can help you in any way, if I can point you in the right direction, please get a hold of me. Real simple, drtomroselle.com. And I'll get back to you. I promise I will. At least I give you another thought process, another direction. Follow me on all your social media sites. We're on tons of them, from YouTube to Instagram to Facebook, Rumble, all over the place. Tell your friends about the program. Let me know what you want to hear. Send me a note. I'm happy to do that for you. If you're in the Washington metropolitan area, look for our classes ongoingly at the Roselle Center in Fairfax. You're always invited. You just have to make a reservation to show up. There's no charge. That's our in-house continuing education program. We'd love to have you there with us. All you have to do is show up, and we'll give you so much information. People have often said it's like drinking from a fire hose. But you know what? It's one that you can drink from that fire hose, but we slow down the volume a little bit so you can actually apply it the right way. I'll see you this Wednesday if you're in Washington, the 12th of the month. I'll see you here next week, and we're going to have a program that I think is going to excite you. It's going to be fun, and it will be a ton of data and a ton of information. Understand that I do this ongoing and really for one reason only. Simply, you deserve the information. You truly do. But more importantly, I love you all. Have a great Sunday. Take care. Bye.